Millennium Development Goals. The United Nations Millennium Development Goals are 8 targets that all 191 UN member states have agreed to achieve by 2015. The United Nations Millennium Declaration, signed in September 2000, commits world leaders to fight discrimination against women and children, disease, hunger, poverty, illiteracy, and environmental degradation. All of these goals cannot be attained without addressing each and everyone. All of them influence, affect, and depend on better global health programs and policies.
Number 1. Developing countries, particularly in Africa and Asia, suffer from extreme poverty and hunger. Poverty and hunger leads to severe malnutrition, which leads to lifelong physically and cognitive, learning and reasoning, damage and affect health, well-being, the economy. Some key suggestions to eradicate poverty and hunger are: first, education. Second, promoting gender equality. Third, producing more jobs. Fourth, investing more in agriculture. Fifth, strengthened nutrition program for children and infants. Sixth, support and protection of developing and vulnerable countries during series.
Number 2. Achieving universal primary education. Persons, particularly women who are educated, are more likely to seek medical care, especially during pregnancy. Ensuring proper nutrition for their families, adopting healthy sanitary practices, and ensuring immunization of children. As an effect, infants and children have a better survival rates, are healthier and better nourished. If these are attained, children who receive primary education are more likely to: first, marry and have their own families at later stage in life. Second, practice family planning and have a fewer children. Third, know rights, responsibility, and civic obligation. Fourth, seek employment and sustain personal and family needs. Fifth, have decreased risks of getting sexual transmitted infection like HIV/AIDS. Supporting and protection of developing vulnerable countries during crisis.
Number 3. Promote gender equality and empower women. Gender equality means equal representation of men and women. It implies that all genders should be equal value and treatment. Equal gender treatment empowers women and other groups, creating opportunities in education, work, finances, and other aspects, which improves the economy and lessens effects of financial crisis. Gender equality can be achieved through: first, early childhood development intervention. 2. Promotion of women's political rights and involvement. 3. Improve reproductive health products and policies. 4. Education integrating gender equality in school curriculum. 5. Improve women's access to work and strengthen labor policies for women. 6. Support and protection of developing and vulnerable countries during crisis.
4. Reduce child mortality. Program and policies which help reduce child mortality, like improving nutritional intake, health care facilities, and infrastructure and other fields which improve child lives. Strengthening local and national health program and policies is one way to reduce child mortality. This includes: first, immunization programs. Second, assuring the survival and better health of mothers. Third, improving reproductive health program and policies. Fourth, better nutrition program for infants, children, and mothers.
Number 5. Improve material health. Improve material health is not only about mother's health but also involves the health and wellness of the family. Maternal health also helps eradicate other problems like poverty, gender inequality, decrease workforce, lower birth deaths, and disability of women. Some ways to improve maternal health include: first, improve and proper nutrition of mother. Second, teaching the benefits of birth, spacing, and small family size. Third, educating young boys and girls about the importance of maternal health. 4. Better and improve access to hospital care, especially obstre, ano to? Obstetric, gynecology, prenatal and postnatal care.
6. Combat HIV or AIDS, malaria and other diseases. Emerging and re-emerging disease like HIV or AIDS. Malaria, influenza and other diseases affect productivity and growth of nations. Some of the effects of disease outbreak are loss of jobs, shortage in professional workers, and creating social crisis. Children are the most vulnerable and are exposed to exploitation and abuse, undermining their normal growth and development. Some ways to combat diseases include effective prevention, treatment, or care like: first, improve housing conditions. Second, increase access to anti-material medicines. Third, promoting safer sex behavior and preventive education for all. Fourth, promoting tuberculosis, screening of HIV or AIDS, personal and TB, directly serve treatment short TB dots, course therapy. And last, promoting the use of insecticide-treated nets to fight mosquito-borne diseases.
And investing supporting sustainable energy like solar, wind, and water energy helps supports job, create business opportunities, and save remaining non-renewable energy sources. Environmental sustainability assures people to live healthier and enjoy a clean and green environment. Some of benefits and sustainable environment are: first, cleaner air and environment. Second, cleaner environmentally friendly and renewable energy. Third, new and inspiring job and business in energy. Fourth, increased access in sanitation.
Number 8. The United Nations, World Health Organization, World Bank, and a government work together to make sure there is fair trade that heavily indebted countries obtain relief and funds to combat poverty. Nutrition and funds for education and social projects. Some benefits of global partnership are: first, expanded international trade agreements. Second, improve access to affordable medicine. Third, reduce the poverty thought government debt relief green. Fourth, development information and communication technology ICT infrastructure.
8 Millennium Development Goals.